The most severe type of macular degeneration is what we call wet macular degeneration. First, we need to get one thing straight. While dry macular degeneration can progress into wet macular degeneration, a patient with wet AMD still does have dry AMD. This can provide its own host of complications, as visual changes can occur from the underlying dry AMD, which cannot be treated. Remember back to the first video when we talked about the different layers of the eye? Well, in between the choroid and the retina, there's a thin membrane. With wet macular degeneration, blood vessels from the choroid burst through that membrane and grow into the retina. This is called a choroidal neovascular membrane, or a CNVM. When your body isn't getting enough oxygen, and the retina in particular, it starts to grow these new blood vessels. However, these new blood vessels are very unstable, and they start to leak fluid. We call this fluid edema. Long-standing edema causes scar tissue, but the scar tissue can't see. This scar tissue causes the central blind spot in wet macular degeneration. Luckily, when wet AMD is diagnosed quickly and treated efficiently, we can get the swelling to go down. Wet AMD blood vessel growth is triggered by a specific protein that we can counter with medications called anti-VEGFs. The anti-VEGFs stop the protein from working and help resolve the fluid that's already there. Using this, typically every month, keeps fluid down and prevents new fluid from forming. Anti-VEGF medications are deposited the same way Izervay is for dry AMD, from the outside of the eye into the vitreous cavity. There are many different anti-VEGF medications, and these are just a few of them. Each combination includes a slightly different way to shut down the new blood vessel growth. It's not a one-size-fits-all situation either. Just as in any area of medicine, different medications work better for different people. Oftentimes, doctors have to do some trial and error to find what works best for their patients.